Good evening, everyone. My name is Joy Fakhouri. I'm a pharmacist with Meyer Pharmacy for over 10 years, and I'm here to talk to you about recommended vaccines for adults as well as certain high-risk medications in seniors. I've always been very passionate about vaccines as preventative health, and so that's one of the reasons I chose this topic. I have a lot of questions in my slides, so I want audience participation. So I'm not just up here talking for 30 minutes. I really want to interact with you guys. Learning objectives from this presentation, we hope that you understand the purpose and impact of vaccines to individuals and the public. Know the top 4 vaccines recommended for adults and which ones you need. Understand what to expect after receiving a vaccine. And discover the top risky medications in seniors and why they should be used cautiously. So I wanted to start with a little bit of background. In the 1900s, the top reasons for death were pneumonia, flu, tuberculosis, and GI infections such as diarrhea. For an example, in 1920, over 400,000 people had cases of measles, and over 7,500 people died from the measles. Over 140,000 had diphtheria, and over 13,000 people died from it. In 1922, there was over 100,000 cases of pertussis, which is commonly referred to as the whooping cough, and over 5,000 people died. So that was the leading cause in the early 1900s. So in 1900, infectious disease caused 46% of deaths. So about half the people died in the early 1900s from diseases and infections. So today, that only accounts for about 3% of the population's reason for dying. So what do you think is causing such a decrease from 50% to 3% of deaths from infectious disease? Does anyone have an answer? Vaccines, what else? Antibiotics. Anything else?
Clean water.
Improved hygienes, clean water, better sanitation, solid waste removal. So as a society, that has made a big impact, but so has vaccines and antibiotics as well. All right, so even though we made such great advancements with vaccines and antibiotics, we still have a big problem. So in the United States, the CDC, which is the Center of Disease Control, estimates that since 2010, flu-related hospitalizations in the United States range from 140,000 to over 700,000. And flu-related deaths range from 12,000 to 56,000. So even though we have the flu vaccine, people are still dying from the flu and getting hospitalized from the flu. The CDC estimates this season alone that there's been at least 15 million flu illnesses, 140,000 hospitalizations, and over 8,000 deaths. Now, I know in the news it's the coronavirus that's the big topic. And I think there's only been over 200 deaths from the coronavirus. It is a big deal, but you know what? We have already over 8,000 people dying from the flu, let alone a coronavirus. So I feel like that should be a bigger topic these days rather than something such as the coronavirus. When it comes to pneumonia, about 320,000 people get pneumococcal pneumonia every year, leading to 150,000 hospitalizations and 5,000 deaths, mostly in the elderly. And each year, 1 million people get shingles and will have the complications, which is severe neuropathic pain afterwards from the shingles. And all these have a vaccine to prevent against it. So today I'm going to talk about 4 top vaccines I recommend for adults, including flu, shingles, pneumonia, and Tdap. So a lot of times people think vaccines are just for kids and children. But why do you think adults need vaccines?
Their immune system is weak.
So you've got a weaker immune system. What else? Yes?
It helps them stay, I don't know.
Keeps you healthy? Okay. So one of the things too is as you age, the levels of immunity decrease, and it's what it's called as the titer. So the amount of antibodies from the vaccines you got as children go down. So you need a booster to increase those levels. So I want to discuss what is a vaccine. We all get vaccines as childhood, but how it works is it's a weakened or killed form of a bacteria or virus. The way it works, once it's injected, it stimulates our immune system to recognize it as a threat and destroys it. Once it's destroyed, your immune system creates memory cells, which are also called antibodies, to help protect you in the future in case that your body encounters that bacteria or virus again. So one question I get, are vaccines safe? Anyone have any comments for that? Yes.
Some people can't have that.
Some people can't.
I have a really good friend of mine, and she just had kids, and she is very adamant about not vaccinating. I see it in different communities and stuff too, you know, where there is this, they're afraid that what they're putting in the vaccines aren't safe, or that people, it's gonna affect them negatively.
Okay, I mean there are some fears of preservatives and different things in there. Vaccines for children especially are non-preservative. They come as single dose vials, so you don't need to worry about having extra chemicals in there to keep it for multiple doses. Just think about all the medications that you guys take as well. How many other preservatives and excipients and other products that are in there to make a tablet as it is. So it's something that we ingest, even all the hormones that they put in our food. So, I mean, I kind of think about it as a seatbelt. Would you put your kid in a car without a seatbelt? You want to protect them, and vaccines are one way to protect your children and protect yourself. And just like any other medications, they go through FDA testing, they do clinical trials, and they get approved just like any other medication. So yes, vaccines are very safe. And again, it's not just children and infants that get vaccinated. So the first one I want to start out with is the influenza vaccine. So why do we get one every year? The virus does change. So the seasonal flu vaccine is designed to protect against 3 or 4 different strains of influenza. So there's influenza A and influenza B. So they look at which one they think is most likely to cause illness in the upcoming season. Just because, like you said, the flu virus does change, so that's why they have to adapt it every year. So who should get the flu vaccine? Well, anyone over 6 months. So the flu shot is indicated for 6 months and older. There's high-risk populations, so children under 5, adults over 50, those that are pregnant, and those who have chronic diseases such as diabetes, heart disease, kidney disease, are especially more prone to getting seriously ill from the flu. When should you get the flu shot? September. Any other? Yes?
July?
Well, I know in my pharmacy, I usually get the flu shot in the end of August. Some people tell me, oh, it's too soon to get it. It's not going to last me all season. I would say it's never too soon to get your flu shot because it does take 2 to 3 weeks once it's injected inside of you to work. And you don't want, and a lot of people start getting sick October, November. So if you have it on board as early as possible, that way you'll be ready when people actually start to get sick. Another issue we have is sometimes the manufacturers run out of supplies. I know this year, the senior high dose, there was a lot of availability issues. So some people, we did have to give them the regular flu shot when they wanted the senior dose, but it wasn't available from our wholesalers and manufacturers. Another question is, will you get the flu from the flu shot? You might get symptoms from it, but it's not the actual flu. So the flu shot, it's dead. It's a killed virus particle that's injected inside of you. So there's no way of causing the flu. There are few vaccines that are considered live, so there is a potential of causing disease, but the flu shot is not one of those. It's a dead particle of a virus that's injected inside of you. There's different types. The most common is inactivated, which goes into your muscle. It comes as a trivalent or quadrivalent, so 3-strain or 4-strain. And there's also a senior flu shot. The senior flu shot is a little bit more concentrated, so it's supposed to give seniors who have weaker immune system a better response. There's also a live flu shot. It's called the flu mist. It is a nasal spray, so this one is live. There's increased risk of side effects. It's only indicated for those that are 2 to 49 years old. So a lot of times children might like it because they're afraid of needles. They might want to get that one, but it's not as effective as the intramuscular one. So I know when it comes to my kids, I'd rather give them a little bit of pain for 2 seconds and give them something that's more effective than the comfort of a nasal spray. Does anyone have experience with the nasal spray for their children, or?
I hated getting them. I knew it was what we were issued when we were in the Marine Corps. They gave us the nasal spray because it was easier to distribute in mass doses, and more people wound up getting sick from that than they actually got the flu.
Yeah, so the nasal one is a live vaccine.
Yeah.
So there's more chances of side effects with that. Alrighty, on to my next topic. Any questions on flu before I move on to shingles? Yes?
My mother always said she wouldn't get a flu shot because every time her father got the flu shot, he got the flu.
Okay.
Now, is that possible? He did have a bad heart, right? But maybe he was getting something before he got the flu shot.
So once injected, it does take 2 to 3 weeks before it works. So if he got sick after the shot, he might have already had another virus inside of him. And keep in mind, this just protects against influenza. There's a ton of millions of different types of viruses that causes similar symptoms. And we get them in the fall, which is the same time people start getting sick. So it might be something else. We're going to talk about side effects for vaccines in a few more slides, so maybe that might help answer your question a little bit more.
I have a question.
Yes.
Why doesn't the influenza season start in the fall? I mean, why doesn't it start in the summer, for example, or spring? You know, like why the fall is when?
It's probably the changing in the temperature,
Okay.
I would think. People are more prone to get sick in the fall and the winter time. I don't know the exact answer to that.
Huh?
I mean, there are viruses in the summertime, and there's some viruses in the fall, but it's probably the changing in the temperature maybe affects that. Great, shingles. So that's a picture of shingles. What is shingles? So it's a chicken pox. So anyone who's ever had chicken pox can get shingles. So the virus, after you get chicken pox, kind of stays sleeping in your brain and your spinal cord. And then there's certain situations that causes it to flare up, and it presents as shingles. So shingles is a rash with shooting pain, and it's usually on one side of your body. The rash turns into red, fluid-filled blisters. It usually dries out within 7 to 10 days. Has anyone ever had shingles?
I was 17.
You were 17?
Yeah. And my doctor told me I should get the shingles shot because I could still get shingles.
Yeah.
But the pharmacist said that it's live and the shingles shot could give me shingles.
Okay, so the old shingles shot was live. The new one that came out 2 years ago is a dead vaccine.
So that wouldn't affect the fact
She
that
should get it.
Mm-hmm. Yeah. So what puts you at risk? Being over the age of 50 puts you at risk. Stress, certain conditions such as cancer, HIV, and other diseases that lower your immune system, having a serious physical injury, and taking long-term steroids, which long-term steroids does weaken your immune system. So the new vaccine is called Shingrix. We've had it since early 2018. It's indicated for 50 and older, for anyone who's had a history of chickenpox. It goes into the muscle, and it's about 90% effective at reducing, preventing shingles. The old one was a one shot. This one is a 2-shot series. So you'd get one, and the second one would be 2 to 6 months later.
I heard that it's a very expensive one, though.
So was the old one. So you mentioned the live vaccine. So there was one called Zostavax, and that was a live vaccine. It's still on the market, but it's not recommended anymore. That one was about 50 to 60% effective. This new one with the second dose gives you over 90% effectiveness. So even though you got some people that got the old one still recommend to get the new one. And some people couldn't get the old one because it was a live vaccine, so those that had rheumatoid arthritis and other immunosuppressive conditions that take immunosuppressive medications couldn't get the old one, but they can get the new one. Does my insurance cover the vaccine? It is expensive. The cash price is around $186 for each dose. If you've got commercial insurance, most commercial insurances, I see it cover it at zero cost, zero copay. Medicare Part D, there are copays. So I've seen people pay anywhere from $3 up to $150, $160, depending on where you are in your donut hole, your deductibles, and all that. But you can always check with your insurance and see what your copay would be. But for commercial insurances, since it is a preventative vaccine, I usually see $0 copays. And where do you get this vaccine? Doctors' offices usually do not carry it. It's going to be found at your pharmacy. And last year there was a shortage. The shortage is gone, so we've got a great supply if anyone is interested in getting the vaccine. All right, any questions about shingles? No?
You get it one time in your life or 2 times?
The vaccine or the shingles?
The shingles.
I've known someone who's had it 3 times.
Oh my God.
So you can get shingles multiple times. Yes.
Is it bad to have shingles?
It's very painful, and if it's not treated right away, it can lead to permanent nerve damage.
How do you get chickenpox?
Well, it's a virus, so you probably got the chickenpox vaccine. So you'll probably never have to deal with chickenpox. But I know when I was growing up, I got the chickenpox. So I can get shingles when I get older. Yes?
How long does it last?
Shingles? I mean, usually 7 to 10 days, up to 2 weeks. But, well, it depends. If you get it treated with antivirals and steroids, it usually resolves. If you don't get it treated, it can have permanent nerve pain and damage, and then you're going to have to live with that the rest of your life. Yes?
I know, like I said, I was 17, and my mother took me to the doctor, and the doctor sprayed my back with dry ice and scraped him off.
Oh, wow.
But I don't think it was the thing he should have done. He was just
I've never heard of that being in form of treatment.
Oh, it was very painful.
I bet. Dad?
I took the old one, shot at the old one,
Uh-huh.
and I took one new one. Do I need to take the third one for the new one?
I think I gave it to you. I gave it to you.
He's in good hands.
I get one.
I think I gave you both.
No,
No? Okay. Okay. Yes.
no, I took one.
What if you get it under 50 years old?
You can get shingles under 50, but the vaccine is I can only give it to you if you're 50 and older.
How often are they supposed to take it? Is it like one time in a lifetime or?
The shingles vaccine? So you get one, and the second one's 2 to 6 months later, and then you're done. You had a question, Luke? Okay. Okay, now on to the pneumonia vaccine. So pneumonia vaccine protects against a bacteria called Pneumococcal Streptococcal Pneumoniae. So people just think it causes pneumonia. So this bacteria also causes blood infections, also causes brain infection called meningitis. There's 2 vaccines currently available. There's Prevnar 13 and Pneumovax 23. So which one should you get? So the Prevnar 13 is for all children younger than 2 years, those that are over 2 years with certain medical conditions, and 65 and older based on the doctor and your pharmacist's clinical decision making. The Pneumovax 23, that's the most common pneumonia shot that you would get. You get it before 65 if you're a smoker, have diabetes, asthma, COPD, alcoholism, or certain chronic conditions like that. Over 65, everyone needs 1 dose. So if you're over 65 and haven't gotten your pneumonia shot, ask your doctor or pharmacist about it. Pertussis. So most people know that as called the whooping cough. It's caused from a bacteria spread from coughing or sneezing. There's been a rise in cases in Michigan, peaking in 2010, with over 1,500 cases reported and 1,400 cases in 2014. About half of babies younger than 1 who get it end up in the hospital. And the younger they are, the more likely they'll need to be treated. So one issue with that is babies less than 2 months don't get vaccines. So that's a big thing, as anyone, whether it's the mother, grandparents, or anyone who's around a newborn baby should get this vaccine. It's a once in their lifetime vaccine to help protect the baby, because the baby cannot get this vaccine until they're over 2 months. So the issue with this is you get it as a child, but immunity does wane over time. So that's why this CDC recommends 1 adult dose over the age of 19. So again, parents, brothers, sisters, anyone who's around babies should get this vaccine. And if you're pregnant, it's recommended with each pregnancy. So before it was just 1 pregnancy, now they recommend with each pregnancy between 27 and 36 weeks to get the vaccine. And this replaces everyone knows that you get your tetanus shot every 10 years. This replaces one of your tetanus shots, because this does contain tetanus as well. So it's got whooping cough and tetanus in it. Any questions about whooping cough vaccine? All right, so common side effects. The most common are local injection site reaction. So pain, swelling, redness of where the actual shot was given. Some people experience mild fever, chills, and feeling tired. So those are kind of like flu-like symptoms, but that doesn't mean you have the flu.
Right.
Yes?
I have a question for that one. Is it rare to get it or not rare?
Rare to get what? Side effects?
Like the one that you were talking about.
The-
Is it like,
The whooping cough?
yeah, is it rare or not rare to get it? Like how many days does it last?
I mean, for an adult, it might just feel like a common cold, but for a baby, it can hospitalize it. So it just, because the babies have weaker immune systems.
So it might not be rare? Like I'm asking, do a lot of people get it?
Well, in Michigan, there was 1,500 cases 10 years ago. So it can also cause headache, muscle and joint aches, but all this usually goes away within a couple days. Your doctor or pharmacist will provide you with, it's called a vaccine information statement, and it's got all the information about side effects and what to do if you have a side effect after vaccine. So that's provided to you before you get the vaccine. So how do you know which ones you already got and which ones you need? Ask your doctor. Another thing you can do is ask your pharmacist. So we have access to something called the Michigan Care Improvement Registry, which is a database for the state of Michigan that lists all the vaccines you've got. I know us at Meyer Pharmacy, we document any vaccine we give into the Michigan database. Your doctor might not, so the record might not be a complete record. But another thing you can do is carry an immunization card. So I've got some immunization cards here. If you want at the end of the talk, I can hand those out for you, so you can have it filled out and keep it in your wallet too. Any questions on vaccines before I move on to high-risk medications? Yes?
What about the measles vaccine? That was in the news, and especially for people traveling to foreign countries. Is that?
I know that was big a year or two ago. Those are available in the pharmacies as well. You might want to check with your doctor. They can check what's called a titer, and they see if you have immunity against it or not. If you're born, I think before 56, or there's 1 year if you're born before they consider you immune, but you can always check with your doctor. They can do a blood work and see if you're protected against it. If not, you can just get the 1 booster dose and you should be good. Yes?
What if you forget that you took a vaccine and then get the same vaccine over again? Is there any repercussion?
I guess it depends on what's the distance from when the first one was given to the second one. I know before I give any vaccine, I check the MICR, I check the database to see if you've already received it, because I don't want to give it to you again. A lot of times we go with what patients say, whether, you know, I think I got this shot, I think I got that shot. So sometimes we'll call doctors and say, try to get a little bit more detail, but sometimes we are kind of working in a vacuum where we don't know exactly 100% if someone did or didn't. They recommend it's safer to give a vaccine than not to get it. So better to have a little bit extra than not getting it at all. Yes?
If you ask your doctor for any of these vaccines, is it readily available? Is it something that you have to know far in advance, or is it just most likely I can go and get any of these vaccines?
You should be able to go in there and get any vaccines. I mean, pneumonia, they should have it at your doctor's office, but at the same time, I know we can carry up to 19 vaccines in my pharmacy. We've got a standing protocol, so with a doctor where I can administer certain vaccines depending on what the indication is. So most people go to pharmacies now to get their vaccines rather than doctor's offices. Yes, Lucas? How many times do we give shots?
No, how many times can you get it?
How many times get what?
Ask your question. How many times do you do what?
The shot?
Okay, let me know if you think of it. All right. So what are high-risk medications? Anyone have any ideas or suggestions?
Medications that cause high risk.
Using the word to define the word, great. All right, so medications that have higher chance of causing harm. They can worsen disease if taken. They can be administered wrong. And they have narrow therapeutic windows. So medications that have to be closely monitored through blood work, just to make sure that it's not too high and not too low. Can anyone name me examples of high-risk medications?
Coumadin,
Coumadin, okay, so why is that high risk?
if they take too much or or forget it or whatever.
Yeah, so they have to do blood tests, checking for INR, just to make sure the blood's not too thin or not too thick for that medication. Insulin.
Steroids.
Steroids. Absolutely. Painkillers, absolutely. So why are seniors at risk?
Lower immunity.
Okay, what else? That's what he said, yeah. Okay, that's one of the reasons. Polypharmacy. So those that take more than 4 or 5 medications at a time, increased risk of, more complicated directions, whether it's 2 or 3 times a day. I know sometimes I can't remember to take a multivitamin once a day, let alone there's some medications you have to take 3 times a day for it to work. Some medications they have to take because they're having a side effect from one medication, so they have to take another medication to reverse the effects of this medication. And another thing is they might go into the hospital. They have certain set of medications before the hospital. They go to the hospital, start new medications, they leave, and the doctor starts old medications, and then they don't really communicate, you need to stop this one from your home medication and restart this one. So then they'll come to the pharmacy all confused, or they'll prescribe these brand name expensive medications, and then they require pre-authorization from the insurance, and the patient never ends up getting it. So there's a lot of gaps, and polypharmacy is one of the reasons why seniors are at higher risk of medication errors. Every year, medication errors cause about 7,000 to 9,000 deaths, let alone hundreds of thousands of hospitalizations. That's one thing that we do at my pharmacy. I've got a resident that he does transitions of care, so he can sit with you free of charge. We can talk about medications before you left the hospital and after, and try to make sure you have a primary care doctor and make sure that you're on your way from the reason that you were hospitalized. Because that's one thing Medicare looks at is 30-day readmissions. They don't want patients, if a patient's readmitted within 30 days for the same condition, they're not going to reimburse hospitals. So this is like a huge topic, and us as pharmacists can make a big impact on that. Multiple providers. They've got cardiologists, they've got their primary care doctors, their endocrinologists, multiple doctors that they see, and a lot of times these doctors don't talk with each other. So they don't know, this doctor prescribed meloxicam, this prescriber prescribed ibuprofen. Me, I know that they're in the same drug class and shouldn't be taken together, but the average patient wouldn't know that. So, one thing we recommend is carrying a list of your medications whenever you go to multiple doctors, that each doctor knows what you take. Decreased kidney function. As you get older, your kidneys work slower. So as they work slower, and your kidneys is what removes medication from your body. It clears it out. So if less is being cleared out, you're going to have a buildup in your blood. So if you have a buildup in your blood, you can get more toxic levels. And a lot of medications need to be decreased or adjusted based on your kidney function. Memory. Did I forget? Did I take my medication? Did I not take my medication? That can be, I have people all the time calling me, I forgot if I took it. Should I take an extra dose, or should I skip that dose, or what should I do? So that can make an impact whether someone takes too much and overdoses on a certain medication because they forgot they already took it. And then you can't see as well, especially with measuring insulins. Those units on the syringes, they're kind of hard to read sometimes. So if you can't see it, you might give yourself too much or too little. And if you give yourself too much, you're going to bottom out your sugar and pass out. So as far as memory, you can use a pill box to help you remember. And I've got some pill boxes here to hand out too if you'd like. So what are examples of high-risk medications that I see whenever I work? NSAIDs, so such as aspirin and ibuprofen. It can worsen heart failure. It can cause bleeding. So there are safer alternatives that you can always check with your doctor. Tylenol is safer than ibuprofen for pain. A lot of people have arthritis, so sometimes Tylenol is not as strong as relieving arthritis pain than ibuprofen. But if you have heart failure, you want to avoid that. So you can talk with your doctor about alternative ways to help control your arthritis pain. Warfarin, like you had mentioned, it's got a narrow therapeutic window, so it's got to have blood work done every month just to make sure it's not too thick and not too thin. There's a ton of drug interactions with that medication, and there's dietary issues. Vitamin K reverses its effect, and that's found in green leafy vegetables. So you have to limit how much kale and spinach and green leafy vegetables that you eat. And that can sometimes be hard to do. Pain medications, like Sonia had said, because of increased sedation, can make you sleepy, it can make you dizzy, you can take too much and overdose. And what pain medications do, they slow down your breathing and can get you disoriented, and then what if you get in a car and you drive and you don't know how it's going to affect you? Antibiotics. Certain antibiotics, especially macrobid, which is commonly, it's known as nitrofurantoin, and it's used to treat urinary tract infections. The problem with that is if you have slow kidney functions and you take that, it can lead to toxicities in your kidneys and other issues. So that's one thing is whenever I see someone over the age of 65, I ask them, how's your kidneys? If they say, I'm on dialysis, I'll say, let's talk to your doctor about switching your antibiotic. Because we don't want any toxic levels of certain medications. Benzodiazepines, most people know it as Xanax. They're supposed to relax you, help with anxiety, but it can cause excessive sedation in seniors, increased risk of falling. So, last one, Ambien. Ambien is so commonly prescribed, but anyone over the age of 65 is higher risk for falling and dizziness, sleepwalking. So there are alternatives that you can take for that. So you just want to check with your doctor and see what's the safest option for you. So what can you do to lower your risk? Talk to your doctor or pharmacist about alternatives. Keep a medication list. Use a pill box so you don't take more medication than needed. Family support, whether it's, you have a husband or wife or child that sets up your pill box for you or sets up an alarm on your phone so you remember to take your medications. And then ask your doctor or pharmacist before taking any over-the-counter drugs. A lot of people think just because it's over-the-counter, it's safe, or if it's herbal, it's natural, it's safe, but it's not necessarily the case. Some people take turmeric over the counter to help with inflammation and joint pain, but it has blood thinning effects. So if you also take a blood thinner, you can have increased risk for bleeding. So just because it's over the counter doesn't make it safe, or herbal doesn't make it safe because you think it's natural. So that's pretty much what I had for you guys. If you have any questions, please let me know. I've got pill boxes, immunization cards, and my business card if you guys have any further questions for me.